Therapeutic hypothermia, if applied within 6 hours of birth, decreases the combined outcome of mortality and major neurodevelopmental disability at 18 months of age. The selection criteria of neonates for therapeutic hypothermia are shown in this table. In addition to standard intravenous fluids and drugs, the things to be arranged include blanket rolled 3 hypothermia system, rectal temperature probe, skin temperature probe of the radiant warmer, 7 liters distilled water, cooling mattress, ECG electrodes, multi-parameter monitor, invasive BP monitoring module and radiant warmer. Wash your hands before performing cooling. Place the system in a room with ambient temperature between 15 degrees Celsius to 30 degrees Celsius. Arrange hyperthermia blanket connecting hose with disposable blanket and 400 series thermistor probes or connecting cables. Pour approximately 7.6 liters of distilled water into reservoir. Stop pouring when water reaches the strainer visible at the bottom of water fill opening. Connect the blanket to the unit by attaching female coupling of connecting hose to a male outlet opening on the bottom row of the unit. Attach the male coupling of the connecting hose to a female return coupling on the top row of the unit. Check that blanket is lying flat and that the connecting hose to unit is not twisted or pinched. Check that the power switch of the unit is in O position, that is, the unit is off. Make sure that power switch is in the I position, unit is turned on. Switch illuminates green. Microprocessor board goes through self-test. Status display in the center of membrane control panel flashes check set PT. Press and hold the test indicator button. Alarm produces a beep. LEDs in the corner of the buttons and low water and power interruption LEDs flash on and then off. All the displays flash. Set the cooling blanket temperature of 33.5 degrees Celsius. Place the infant on the warmer in the supine position with the entire head and the body resting on the cooling blanket. Place and secure central and arterial lines before starting hypothermia. Gently insert the patient rectal probe 2 cm into the infant's rectum and then secure to infant's leg with tape. Use auto control mode for hypothermia treatment. Let the infant lie directly on the cooling blanket and allow only diaper during monitoring of baby. During rewarming phase, record rectal temperature every 30 minutes until temperature goal is achieved. Record heart rate, respiratory rate, oxygen saturation and blood pressure every 15 minutes for the first 2 hours, then hourly until rewarmed. The frequency of monitoring and investigations after initiating therapeutic hypothermia is shown in this table. Document vital signs every 3 hours once the temperature goal is achieved and continue rectal temperature monitoring for another 24 hours. Obtain the laboratory report for the following once the temperature goal is achieved: glucose, coagulation profile, that is INR, PTT and fibrinogen, complete blood count, arterial blood gas with lactate. Wash hands. Document in nurse's record. Stop active cooling measures when rectal temperature falls below 34.5 degrees Celsius, infant has persistent hypoxemia on 100% oxygen, there is life-threatening coagulopathy, or there is an arrhythmia requiring medical treatment. Use rewarming procedure, notify doctors immediately and treat as per doctor's orders. Thank you.